and I am John Rowe. I'm retired, so I have no financial interest whatsoever in amalgam or in the outcome of this hearing. Previously, however, I did work for the U.S. House of Representatives Committee on Government Reform and Oversight and its Subcommittee on Human Rights and Wellness. That was under the supervision of Congressman Dan Burton. As chairman, Congressman Burton conducted more than 20 hearings on various aspects of mercury in all of its forms and the effect it had on human health and on the environment. And I personally coordinated a series of hearings specific to dental amalgam. Now, during those hearings, quite a variety of well-qualified witnesses from throughout the country and abroad provided very compelling evidence of the harm that mercury in all of its forms does to human health and to the environment. And their testimony was always well documented. By contrast, the various federal pro-amalgam witnesses that appeared, including an FDA witness on November 14, 2002, basically simply stated that, well, you know, we've been using this stuff for a long time, and if there was any harm, we'd probably know about it by now. They offer no credible documentation for their point of view. My personal disappointment with the apparent lack of scientific expertise on the part of the FDA was borne out by one of the FDA's own organizations. There is a science board. They have a subcommittee on science and technology, and that subcommittee released a report in November of 2007, and it was titled FDA Science and Mission at Risk. I'll give you just three quick quotes from that report. Quote, "The FDA cannot fulfill its mission because its scientific workforce does not have sufficient capacity and capability," end quote. The second one is, quote, "Today, not only can the agency not lead, it cannot even keep up with the advances in science," end quote. And the final quote, I think, has relevance to your committee. It is, quote, "Recommendations of excellent FDA reviews are seldom followed," end quote. Some of you participated when the Dental Products Panel and the Peripheral Central Nervous System Drug Advisory Committee met on September 6th and 7th, 2006. You were supposed to rubber stamp a white paper from the FDA that said amalgam are safe and effective. You didn't, however. You raised some very legitimate questions. But the FDA went on their way as if nothing had happened. And a while later, they classified amalgam as Class 2, basically safe and effective. So my advice is very, very simple. Since the FDA does not have the scientific capacity to make a sound decision on the use of mercury-based amalgam, they should rely on the advice of people that do. They should rely on the expert witnesses who appeared before Congress. They should rely on the many witnesses.
Sir,
yes.
30 seconds.
Thank you. The many witnesses who are testifying at this hearing, and this time they should rely on your advice. Now, I thank you for listening, and I hope finally the FDA is listening.
Thank you very much.